So, hello everyone. So, we are studying about neuroradiology. In neuroradiology, we are discussing about stroke, very important topic. Okay. In previous class, we discussed what is the investigation of choice of stroke and what are the causes. Okay, and we discussed about arteries which will affect in the brain. Okay, which arteries? MCA, PCA, ACA. Okay, and about the protocol, what to be done, that is be fast. Okay, so this is the mimic, this is the short mimic. We have to remember whether we are treating about stroke patients. So what is meant, what if the patient have two problems in the brain, which area is affected? So if the patient have three problems, which area of the brain is affected, you can assume and you can treat the patient accordingly. Okay, and secondly is that stroke is a clinical diagnosis. Stroke is a clinical diagnosis means if the symptoms appears with the symptoms of, with the help of those examination and symptoms, you can diagnose the disease and you can treat. But why we are doing CT or MRI? Because to differentiate whether the stroke is ischemic or whether the stroke is hemorrhagic. So this is the thing we have to remember. So if the ischemic, the treatment plan should be changed. If the hemorrhagic, the treatment plan is changed. So if the hemorrhagic means the reason is hypertension, and the ischemic, already we discussed cardioembolism or large vessel atherosclerosis are the reason behind the ischemic stroke. So let's discuss and see the stroke while the stroke images, different images. Okay, first I will see you one image. You can understood about that, about the stroke. So this is ischemic stroke. So this is the area where blood supply. This is the artery. Okay, this is the artery where the blockage is happened. Okay, any clot occurs directly here within the brain artery, or whether the clot developed another place in the cardiac region. So it travels from that area to the brain and it is blocked. So blood can't flow that area. Blood is not reaching to that area. So the it is damaged. Sorry. So the area is damaged. Means like example, we have a wonderful example that during summer season, what happened? The wherever there is grass on the land, okay, so water is not available in the deeper level because of the summer. Water is evaporated and become the sky in the, you can see that. Okay, so water is evaporated. So what happened? Due to the not reaching of water to the grass will become die and it will die and it will dry. Okay, same issue to the brain. So the large amount of, okay, the large amount of blood supply is stopped to the brain, so the brain cells are damaged. So we discussed that there is a window period according to allopathic doctors, that is 4 to 6 hours. So if you treated this patient within this window period, there's a high chance of recovery, reversible, or you can stop further large issues. Further, the patient becomes serious. Okay. This is the window period. So within the window period, what the doctors will do, we'll discuss that also. So here you can see that this is the artery blocked. So the supply to the brain is restricted. Okay, so the area is tight. Okay, this is called ischemic stroke. And hemorrhagic stroke, we already discussed in first class itself. So this is the artery due to the raised pressure in the artery. Okay, raised pressure in the artery, uh, blood flow, or we call hypertension due to the hypertension. So the artery ruptured within the brain, so the blood flow in the brain, and it will start giving pressure to that area. Okay, so in that case, you have to treat with different steps. In that case, ischemic stroke, we have to treat with different steps. So let's see the image, how the CT scan looks like in this. You can see that this is the CT scan, and you can see we discussed ACA, anterior cerebral artery, PCA, posterior cerebral artery, and middle part of the brain, middle cerebral artery, which supplies middle part of the brain. So this is affected here. So you can see this is the area where the supply of the blood is stopped. So that is the reason you can see in the gray color or black color. Here there is different color. This is different color. Okay. So this is a CT scan. And how the MRI look like in stroke. So you have different areas strokes you can see. So this is the MCA, main MCA, means whole MCA is affected. Already I shown you the picture. Now let's see the image again. 1 second, please. Give me. So this is the image I am showing you. So you have to remember this picture, very important. Circle of Willis, we call his. You can see this is the arteries, different arteries. Okay. You have here that middle cerebral artery. This is the large artery. Okay. Supplying this entire part of the brain, sidebar, pura, entire middle part. Okay. If this block happen, so the brain will affect like this, like this. Very bad, very bad. Main artery occlusion happen, blockage happen. So we'll call occlusion of mid-cerebral artery. What we will call this? Occlusion of mid-cerebral artery. Very dangerous. So patient have hemiplegia, means complete weakness of upper limb, hand, complete weakness of leg, lower limb, and facial deviation. Sometimes unable to swallow. Okay, difficult. Sometimes he needs Ryle's tube from the nose. It will drop into the stomach. So where liquid is poured because of MCA, very dangerous. Okay. Next, you can see that this is the another MCA. Okay. Next, we have this is anterior ACA, MCA, means mid-cerebral artery have branches. You can see here. This is the mid-cerebral artery branches. If that part, anterior part is affected, so only that part of the brain is affected. So we will get those clinical symptoms. Okay. And you can see another image here. If the branch of middle MCA, so only here is affected, backside posterior MCA is affected. So this is how you are getting, you will get with angiography. You have the one scan that is called CT angiography. We'll discuss later. Okay. And you have cortical MCA, perforated here, and you have PCA. Okay, PCA, posterior cerebral artery, and you have ACA. This area is affected. Anterior cerebral artery. This posterior and anterior, this arteries. You can see that anterior. This is the anterior cerebral artery. Okay, and you have posterior cerebral artery both side. Okay, so ACA front, posterior backside, either light or left, where it can be affected. So the symptoms may be developed. So it is very, very important. So doctor will do the scan. That is the reason to understand the area, which area is affected. The patient have similar symptoms. Okay. So let's discuss that after arriving of any stroke patient, how mostly the doctors will plan. Okay. If any stroke patient ever arrive in the hospital, what they do? So whenever a patient become unconscious, we have to remember that whenever we have when a patient become unconscious in the stroke also, we will have uh, unconscious like symptoms. Okay, so in that we have one another test we have to be done, that is RBS. Very, very important thing you have to remember whenever the patient had any type of unconsciousness. RBS is very, very important. So random blood sugar levels. So most of the diabetic patient or dehydrated persons or whoever not taking proper diet, so sugar levels decreased. So okay, this will be trigger them. So this leads to trigger the uh, stroke. Okay, it will trigger the stroke. Okay, symptoms. So that is the reason whenever a patient come to hospital or any clinic unconsciousness state, so we have to very, very particularly go through this test. RBS, very, very important. So if the RBS we know that this is which test with glucometer now available in every hospital and clinic. Suddenly we'll prick and you will take the blood and you will have the strip, just one drop of blood needed. Then you will get the sugar levels. Okay. So if the sugar levels are less, so I have to go to that protocol how to manage hypoglycemia. I thought hypoglycemia is more or less than for 60 milligram per deciliter. Okay, so we have medium, moderate, and severe hypoglycemia. According to that, we have to manage that patient. Okay, so sometimes you will get you have to go you have to give oral sugar. Okay, sometimes you needed liquid sugar based. Sometimes you need IV sugar, that is DNS. In the hospitals, they will give or fructose. Okay, 10% you will get 10% or something, 20% will get fructose something. 100 ml you have to give gradually. Okay, now so if the RBS is normal, check the RBS, that is normally 90 milligram per deciliter. Now what do I have to do? So first thing that the doctors will advise, that is first investigation. First investigation. What is the first investigation? This is NCCT head. CT head. Okay. So to differentiate whether it is hemorrhagic or ischemic. This is the basic protocol. First step, we have to remember that. Okay. So after that, what will happen, that whether it will be hemorrhage, whether it be ischemic. So first we'll start with hemorrhage. What protocol, what to be done? If the patient come unconsciously, have weakness, be fast, balancing, eye issues, okay, facial paralysis, okay, and arm weakness and slurred speech. These symptoms are there. So you did RBS and NCCT also, and if the patient, the CT shows hemorrhagic bleed. Now what we have to do? We have to, the patient is mostly departed to the neurosurgeon. So that is the, we have to contact with neurosurgeon, and what to be done according to his advice, you have to follow. And second thing, we have to remember that we, in the ischemic stroke, the the guidelines that they will give anti-thrombolic agent, means they will give thrombosis will, they will do thrombosis, IV thrombosis, means to reduce the clot size, or to burst the clot size, you need to give one injection through IV. So it will go to the area and it will reduce the size, it will decrease the size of clot. So in the hemorrhagic stroke, that is not given, that is contraindication. Means if you give, if a person give anything like that, so bleeding will happen much more. Okay, that is contraindication, is not given in hemorrhagic stroke. So this is how hemorrhagic stroke will manage. Next, we have to discuss ischemic stroke. Ischemic stroke, the patient arrived and you done the CT scan, no hemorrhage is shown. So first step is no hemorrhage. No hemorrhage shown in CT. Okay. Now, two things we will discuss in later class. Okay. Here not. First is, when you are calculating the CT, you have to see the ischemic stroke to how much extent it is available. Okay. First thing. And second thing is that what is the time period when the patient arrived in your clinic, is available in window period or outside the window period. So if it is no hemorrhage, if he comes to window period, so neurologist will decide, okay, he will take the call, final call, decide to do IV thrombolysis. Thrombolysis. So if the window period 4.26 hours, okay, this is very important. If he come after window period, okay, so what we have to done? Neurologist will decide according to that. We will not discuss here. But after coming window period, one thing they will do, that rule out that which artery is blocked. So that's the reason they will advise C2 and CT angiography. So in that you will get occlusion, or, and for occlusion happened here. Okay, means the artery blockade happened here, but in the brain or heart we have collateral, means if this artery block, but we have another artery which supplying the blood supply to the brain, so that is called collateral. So which collateral artery is supplying blood supply to that area. You can able to know that in the CT angiography. Okay, so this is the thing. And the another thing, the patient will come in after window period, or we will call this wake up stroke. What we will call this wake up stroke? What we will call wake up stroke means the patient slept in normal condition. After wake up, he is getting weakness in the hands, facial paralysis, unable to speak, unable to walk. So this is called wake up stroke. Or he will come after 6 hours. We have another scan, that is CT perfusion. So we'll discuss that also in coming classes. CT perfusion. So this is the thing. So if he come in window period, they have the chances of IV thrombolysis. After window period, you need to know which artery is blocked. So you have to go through CT angiography, or he will come after mostly 6 hours or 8 hours one day. So you have another type of scan, that is CT perfusion. So I will show you the CT angiography. 1 second, please. So here is the image, you can see. So this is the angiograph. In that you can easily see this all the arteries of the brain, anterior, posterior, mid cerebral artery, circular of Willis, all these images are there. But now we'll see the MCA, mid cerebral artery. So this is the image. You can see that this is the image. This is the mid cerebral artery, okay, which is coming. Here you can see that this is the large occlusion blockage. So in this image, you are saying that there is the occlusion in large mid cerebral artery. Okay. So this is how then neurologist will take the call according to his condition. We will discuss about CT angiography, CT perfusion, and different things related to that scan. Okay. So tomorrow we'll discuss about that.